This video is on extubation. So we're going to come in making sure we have the order for extubation, making sure the patient has met criteria to be extubated, has passed his trials for extubation. So we'd explain to the patient what we're going to be doing. We put him in a high Fowler's position. We would be draping our patient with a towel to make sure we don't get him or her dirty. We'd make sure we have all our equipment available. We'd have a yonker for oral suctioning. We're going to have a 40% AEM or AM set to 40%, and we're going to have a syringe to deflate our pilot line from our ET tube. So we would set our patient up, high Fowler's position. We'd say, Mr. Smith, we're going to be extubating you today. So what we're going to do is we're going to take the tube out of your mouth. We're going to suction your mouth to make sure we get all the secretions out. We're also going to inline suction through the ventilator to make sure we get any secretions that are in the tube and in his chest out prior to extubation. Once we take the tube, or get ready to take the tube out, we're going to hook our syringe to the pilot line, and then on the count of 3 I'm going to have you cough, and as we're coughing we're going to take the tube out. So we're going to go ahead and get ready for extubation. So I'm going to go ahead and hold on to my tube. I'm going to go ahead and so the patient will be sitting up in a high Fowler's position. I'm going to take off our Hollister, and we are going to inline suction, making sure we get all secretions out. We are also going to orally suction our patient, making sure we get all the oral secretions out. We don't want him to aspirate. Our AEM will be connected to the wall and flowing already. So we're going to have the patient be sitting up. We're going to go ahead and attach our syringe to our pilot line. Have that ready. Okay, Mr. Smith, on the count of 3 we're going to go ahead and take our tube out. So I'm going to go ahead and sit him up on the count of 3. 1, 2, 3. Deflate, and we'll pull the tube out. Have him cough, cough, cough. We're also going to orally suction to make sure we don't have any oral secretions left behind. I'm going to go ahead and place the 40% AEM on the patient. Go ahead and take some nice, slow, deep breaths. As the patient's taking the deep breaths, we're going to go ahead and auscultate our patient's chest. We are also going to auscultate the side of the neck to make sure that he doesn't have any stridor. I'm going to listen for just a little bit. We'll advise the patient not to talk to kind of help the edema if he does have any, to kind of preserve him, because he will have a little bit of a sore throat maybe. So just nice slow deep breaths. We'll make sure he's on pulse ox. We'll monitor his pulse ox saturation, make sure he maintains a good saturation with that. We'll come document everything that we've done with the patient and come evaluate him in 15 to 30 minutes to make sure he's maintaining good saturation and pleth. And that is extubation.